this video, we will look at Patients Know Best and how it can be used to support your students to learn about digital healthcare and shared care planning. As health and care students, the experience of meeting and interacting with patients is extremely important. However, there can be difficulties associated with this. Often, students will see a patient only once, which makes it impossible for them to get the full experience of how their health changes day to day or impacts their life. Additionally, vulnerable patients may be unable to travel, reducing the range of conditions that the students will encounter. Interprofessional learning is important for healthcare students and has been shown to promote knowledge exchange and to have positive impacts on patient outcomes. However, this can be difficult to organise. Case study and problem-based learning is a core part of the curriculum, but usually requires students to be in the same location as one another or to have access to the same resources. Patients Know Best wants to resolve these problems for education institutions. That's why, as part of our social mission, we offer the Patients Know Best platform free of charge to any institution, teaching our healthcare professionals about the future. PKB functionalities include asynchronous messaging between patients and students, so either party can interact at their own convenience. It also offers the ability to track symptoms and add medications, plus the ability to work on shared care plans. By using it in your university, your students will be able to get the full experience of how a patient's health evolves and impacts their lives. Distance would no longer represent a problem, as students could interact on the platform with patients who are unable to travel or communicate with them outside of office hours. Students from different courses can work together on the same cases or communicate with the same patient volunteer, as well as with each other. Students can work on case study patients on the platform, sharing ideas through messaging, adding or reviewing medications, test results, imaging reports, and more. Universities can use PKB with simulated and fictitious records or with patient volunteers or actors. Our work with healthcare institutions started in 2014 with Leicester Medical School, and since then we have worked with a number of universities, including schools of pharmacy, midwifery, and medicine. The education partners we work with come back year after year to work with us, saying, "Our students will be working in new ways when they graduate, so we are using PKB to provide them with experience of digital healthcare." In 2022, our free-of-charge educational programme was shortlisted for the Best Educational Programme for the NHS. A patient volunteer who has worked with medical students on the PKB platform for a number of years recently commented, "I really think this is the future." Thanks to PKB, the next generation of healthcare professionals will be so much further ahead of the game compared to previous generations of practitioners because they are learning to really listen. More information about using Patients Know Best with your students free of charge can be found at patientsknowbest.com/education.